Today we have a patient who had previously been injected with an unknown product. We think it's silicone, and she has some pretty firm masses in the buttocks here outlined by red. She has a lot of low back pain here, and I believe the product has migrated from the buttocks here to the lower back, which is very, very common. So I'm going to make an incision there, go south and get this product out, as well as the scar tissue that surrounds it. So let's go to the operating room and I'll show you how we do a posterior incision to remove silicone and its injected scar tissue.
It's called a bovie or electric cautery. Basically, it's electricity that goes through the patient and cauterizes or burns the tissue to primarily stop the bleeding, but it can also help with my dissection and speed up the surgery. She's having pain in the buttock. Occasionally the pain in her buttock radiates down her legs in this thing called sciatica. Sciatica is an irritation of the sciatic nerve as it goes from the buttock down the back of the leg. And the reason for that is that the scar tissue around the sciatic nerve compresses on the sciatic nerve, sometimes can press on the nerve or sometimes can surround the nerve and strangulate the nerve, leading to this sciatica or this leg pain. So this is not normal. You see how it's kind of yellow and fatty, and you see those little clear balls right in there? That's silicone that was injected. Look how deep that needle had to be. You know, a good 4 or 5 inches to get into the muscle, and the injector injected into the muscle. It's lucky she didn't die during the injections, because that stuff can get in your circulation, then into your heart and lungs, and you die on the table. So not good. So basically we need to clean up all this stuff. This stuff you could not get out with the suction technique. These little bobas, when you see those little gray balls right there, yeah. and there, and there, and there, and there, and there, and there, they're all over the place. These are all silicone balls. So we need to clean all that up. So basically I'm resecting the tissue in the lumbar, the low back region, to get rid of some of this low back pain for her from the silicone that's migrated from the butt into the low back. So I'm getting out this quite large specimen from the lower back. patient's right buttock. This is the bottom side of the flap. Most of our product was in the muscle. Now the white stuff that you see there, that's scar tissue with associated product. But again, most of our product was deep down in here. This is again the bottom of the flap. You're gonna see, here's a bovine, there's a silicone ball. That's the goo, and here are more silicone balls. But deeper down, this is where it got concerning in the muscle. You saw it in the patient. But you can see as we immediately get in the muscle, see there's a silicone ball, there's a silicone ball. So the patient who injected her, or the person that injected her, would have got to use a needle that was this thick to go in and get into the muscle. So think about that. That's a needle that long of somebody untrained coming at you with a foreign product injecting the buttocks. Not a good idea. So we're done here. Posterior body lift incision across the top of the buttock, migrating down to get rid of the product and the associated scar tissue, not only in the fat, but also the muscle in this case. So also I had to raise and reduce the buttock to get that specimen out and the incision closed. I decided to put a little bolster dressing here, which is a yellow gauze on either side to sort of create a bumper to take the pressure off the incision to allow that to heal up really well. So that's how we remove product. We also went up into the low back here to get rid of this product that had migrated to the low back, causing her low back pain. Should get a great result. So thanks for watching. Please subscribe. We'll see you next time.